Mrs. Smith. My name is Amanda. I'll be your nurse today. I have doctor's orders to go ahead and insert that NG tube, that nasogastric tube. Okay, is that all right with you? All right, so I'm going to go ahead and wash my hands. I'm going to provide the patient privacy. Okay. I'll go ahead and get some gloves on. Can you please state your name and date of birth? Okay, everything matches up with the computer. Okay, so what I'm going to do, gloves. Is I'm going to so we're going to go ahead and put the side rails down. I'm going to lift the head of your bed up to a hyphalarys position. This is just sitting straight up. This is going to help with swallowing and getting that tube to go down easier, okay? I'm going to raise the bed up to my level. Okay, so I see in your history that you do not have any history of any procedures or anything that is going to affect this, any history of nasal polyps, nosebleeds, any oral or sinus surgeries. Is this correct? Okay, so what I'm going to do, I'm going to show you. My patient is this Cabbage Patch doll here. I'm going to show you all my supplies. Okay, so I have my stethoscope. This is my 60 milliliter syringe, turkey baster. I did not have that. I have an empty cup here, a full cup of water for my patient to drink. This is my NG tube. I did not have a lubricant packet, so I'm going to use the sugar packet right here as my lubricant. Scissors if needed. My permanent marker to mark the tube. Paper tape. Pen light. And this pencil here I'm going to use as a to check the gag reflex. Okay. My tongue blade, sorry, I couldn't remember what that was called. Okay. So, what we're going to do is I'm going to go ahead and keep you over here. I opened this earlier to practice with, but we're going to open this stuff up. Okay, what I'm going to do is I'm going to get the lubricant here. We're going to go ahead and put it on here so that that's ready. Open the package up. Okay, so then I'm going to use my pen light to assess my patient's nostrils. Okay, so I'm just going to go ahead and look up and assess each nostril, okay? All right, everything looks good and moist. No blockage. Oh. Okay, so now I'm going to use this tongue blade and I'm going to go ahead and assess your ability to swallow. Make sure you're not at risk for any aspiration, okay? Let's go ahead and open up. Okay, very good. All right, so now I'm going to go ahead and measure the tube. Right here. So this is your NG tube, and this is the tip here, okay? So what I'm going to do is I'm going to measure the tip of your nose to the tip of the ear. And I know the ATI video said from the tip of your ear you can also go down to the sternum area, the xiphoid process, and this is going to show you an more accurate amount to go into the stomach. Okay, so I'm going to go ahead and put a piece of tape here just to mark, so I know how far to insert the tube. Stuck there. Okay. So, I'm going to go ahead and come back to my table here. I'm going to dip about 4 inches into the lube of the tip. I'm going to change gloves. These ones are torn. I want some clean gloves for this process. It doesn't have to be sterile gloves, just clean gloves. Okay. I'm going to rewash my hands. Get these on. Hands have been sweating. Okay. And then also, I have my emesis basin here. I'm going to put this next to the patient just in case if you have any gag reflexes, you feel like you're going to, vomit. This is right there. And I am going to put some tissues next to you. Sometimes this causes your eyes to water, okay? So we're going to go ahead and put these right next to you. I'll go ahead and bring you back to my patient. Okay, so I dipped the tip of the NG tube in lubricant about 4 inches. We're going to place a towel over the patient just in case. Okay. All right, so I'm going to go ahead and grab. Here's a cup of water. I'm going to have you hold your breath at first, but once I get it to the back of your throat area, I'm going to have you swallow. Keep swallowing, and I'll tell you when, okay? This is going to help you with the, this is going to help it go down better. Okay, so this tip is lubricated, okay? So on the count of 3, I'm going to go up the left nostril. 1, 2, 3. Okay. All right, keep swallow. Go ahead and swallow your water. If you are in any pain, just hold your hand up and let me know, okay? I know it's uncomfortable. All right, this is going to go all the way down until you feel resistance or the end of my marker. I'm going to tape this to my patient's cheek just because it's actually not in her stomach. There's nothing really holding it on. Okay, so before I do anything else, what I'm going to do is I'm going to use my stethoscope here. And I'm also going to use my pen light. Can you go ahead and open up for me? And I'm just going to assess that everything looks okay. All right, now I'm going to go ahead and assess the breathing sounds. So I'm going to go ahead and have you take deep breaths for me, okay? I'm going to listen to your breathing. I'm going to listen on both sides to her chest, make sure the breathing sounds good. Very good. Very good. Okay, everything sounds good there. So then I'm going to take my 60 milliliter syringe. I should have already had it connected, but this actually doesn't really connect, so we're just going to pretend. Okay, so here I'm going to withdraw. All right, I'm going to put it in a separate cup here, and then at the end we're going to use this to test the pH. Okay. All right, so what I just withdrew was your gastric aspirate. Okay, so then what I'm going to do is I'm going to take some paper tape or some strips, and I'm going to keep this on the tip of her nose, the very tip so it doesn't pull. Okay, we're just going to pretend that's down. This is really difficult. Okay, and then we're also going to use a clamp. I don't have any clamps with me, but we're going to use a device to clamp this to her gown so it doesn't pull. I'm going to move this blanket here so I can get to your gown. We're going to secure this on your gown so it doesn't pull, okay? Okay, and I'm also going to mark with a marker on the bottom. There. Okay, so everything's fastened. Are you feeling okay? Okay, so next what I'm going to do is I'm going to test the pH of this just to make sure that it's placed accurately in the stomach and I got the accurate fluids. Okay, and then with the test we're going to match the color and everything with the pH. Okay, so I'm going to go ahead. I'm going to leave these tissues next to you just in case you need to wipe your eyes along with this emesis basin, okay? So right now, I'm going to go ahead. You are not allowed to have your head back any more than 30 degrees. This is just going to help suction all that out. I am going to give you the call bell, so if you feel any, being uncomfortable, any pain, you go ahead and call that button, press that call light button, and we'll come assist you, okay? All right. All right, the bed is no more than 30 degrees. I'm going to lower the bed, put the side rails up. I'm going to clean up all of my supplies. They're going to go into the garbage. I'm going to take off my gloves. I'm going to wash my hands. All right, Mrs. Smith, you press that call button if you need anything, okay? All right. And I am going to document everything that I did for this patient. And that is my insertion. That is my insertion of the NG tube.